Well, Medicaid spending is almost certain to get cut significantly under the emerging Congressional reconciliation bill. But what is Medicaid anyway, and what will happen if spending drops? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of the Yukon Health System.
It's a funny question to ask, John, what is Medicaid? But it's been around for a while, and I'm not sure actually that all of our folks that are actually running Medicaid actually know what it is. So what is it?
Well, Medicaid is the program that the federal government and the state government both financially support to provide health care for the poorest and the most vulnerable populations that would otherwise not be covered by insurance. It's typically tied to some element of disability, some element of an absence of income. And it also, was originally started really for the disabled and for as aid for families with dependent children to make sure that young poor mothers could get health care. But as a practical matter now, through multiple iterations, it now covers through the Obamacare expansions in Medicaid a substantial amount of folks who are able-bodied working families. And so right now you've got everything from complex dual eligibles who qualify for Medicare and Medicaid on Medicaid, and also now individuals who are working full-time jobs but probably can't get insurance, or probably certainly can't get insurance at an affordable price through their employer. So it's actually a pretty broad category. I think it's between 70 or 80 million Americans are now on Medicaid. It's pretty broad. It's a broad-based care for a lot of everything from ranging from complex conditions to healthy, hardworking, relatively poor employees.
Yeah, I mean, it's it sounds like something where it's just a fringe program to begin with. Those that can't otherwise get insurance or whatever, and now we're talking 80 million people or so, which is makes it very, very big. And of course, the total dollars add up, and it's something like 600 billion from the federal government, a little bit more, and close to 300 billion from the states. That was last year, so that's heading toward $1 trillion. A lot of it's in managed care. John, part of it, what was behind my question of what is Medicaid, is that when you talk to people who have Medicaid, and it's, as we said, 70 or 80 million, not everybody knows that they actually have it. And part of that is due to branding. So here in Massachusetts, they call it Mass Health, and Oklahoma, Sooner Care, California, Medi-Cal. So it's partly the name. People don't associate Medicaid with themselves. And there's also just a lack of clarity of how health insurance works in the first place. And I think that's all boiling in there somehow.
Well, I think the challenge for Congress put together sort of a mock or model budget without details that would allow the Republican-led leadership in the Congress, in the House, to effectively pull the classic reverse Robin Hood, to steal from the poor and give to the rich, to fund a very large tax break for corporations and wealthy people. And I think that that the majority of the savings in that, or of that transfer of taxes that businesses and wealthy people are currently paying, would be made up for an $880 billion over a decade reduction in Medicaid. But they didn't give any detail. So everybody's you talked about a trillion. Well, you've got nearly $1 trillion of cuts to a program that cares for the poorest and the near poor, going to tax breaks for businesses and wealthy people. That's where the majority of the money would go. Seems kind of crazy, but it does beg the question of what should Medicaid cover and how should it cover? And maybe Dave, you could go into the different things that Medicaid, what's the structure of Medicaid today? Because it's not just the people who are covered in Medicaid that are vulnerable here. It's also anybody who's a doc, a nurse's aide, or a hospital, all of whom depend pretty substantially on the dollars that flow through that Medicaid program.
Well, John, that's a simple sounding question. It's a hard question. Let me start by going off into 1 second on
Well, you
why.
could slow down if you're
Yeah,
struggling.
I am struggling, but let me say one other thing first. Was we went right to, hey, they need to, but there's this desire to expand or extend tax breaks, and therefore Medicaid gets to be cut. Well, it's not the only large program, but it's kind of the only one that doesn't have a protection associated with it. So, Medicare announced, okay, we're not going to cut Medicare. Social Security, not going to cut that. The military, not going to cut that. Maybe going to grow it. Interest on the debt. So if you add up all the things that are untouchable, you're kind of left with Medicaid is the big thing that's there. So that's why we're talking about it in the first
Although,
place.
to be fair, the president also said he's not going to cut your Medicaid. So,
Right.
of course, you're never quite sure whether he understood Medicare or Medicaid, but he did say, basically he's going to keep his hands off of Medicaid. And then, but the Republican leadership said they have their hands all over Medicaid.
Yeah.
So,
No, and I think just the math would say that you need to go after Medicaid. So I think that's what's expected. Now, going back to my comment before about how people don't know that they have Medicaid, they're also not directly receiving the funds. So when Medicaid money is spent, they don't send it to, John Driscoll or John Q. Public. It does go to pay for services that are in hospitals or physician offices, medications, nursing homes in particular is a big one. So that's where actually the funds go. So if there's a cut, then that's who's affected. Now, where are some of these folks? They're actually in places that are economically disadvantaged as a whole, as regions, in particular rural areas. And if you go into, if you ever drive into, like let's say an old town that's kind of down in the dumps, and you see, oh, there's a big new building there. It's almost invariably a hospital or a medical clinic, and a lot of that money is from Medicaid and Medicare as well. That's coming in. So it's a major source of funds flow into places that otherwise would not be receiving those funds, and that's why I think it's a tricky thing to deal with.
Because what you have in committees of jurisdiction in the House and the Senate are a lot of committee chairmen from ruby red states that were big Trump supporters, whose hospitals and doctors in rural areas are almost exclusively dependent on these Medicaid dollars continuing to flow. If those are cut off, healthcare could stop. A lot of these rural hospitals would close. We've already got a bit of a crisis in rural healthcare where we don't have enough doctors and hospitals. So a major cut would mean major pain for these rural areas. Now, honestly, Dave, I don't see how they're going to square that circle because what they're talking is sort of a quick layer cake cut for something that is already a pretty fragile system when you're looking at low-income areas.
A lot of these reforms or cuts to Medicaid are framed in moral terms. And so a big one is about work requirements. The people shouldn't be sitting around, collecting their free healthcare or whatever. That's a big one, and that's where a lot of the emphasis has been. And I've even seen things go further, saying that these are things that just the states are just using to enrich themselves by paying for all sorts of things that have nothing to do with healthcare. And let's get back to doing Medicaid essentially for charity cases. How does that all come together?
Well, I think that there are isolated examples of where some states may have paid for some stuff, particularly in an experimental mode that was addressing the social determinants of healthcare. Frankly, we know that if you don't, that some of the things that have been pointed out are things like food subsidies, and we know, frankly, that if you're hungry, you're likely to get sicker and be a more expensive burden on the system. So I think there are some reasonable questions to ask, but I think it's often aimed at sort of targeting the odd anecdote. I actually think this is going to be really hard because Medicaid is an elemental part of how people get healthcare and work for low-income jobs that don't provide insurance. It's an elemental, perhaps the last standing part of healthcare in a lot of these rural areas. And I think if you start pulling the pin on that, you could have some real catastrophic consequences where you have health. You've heard of food deserts, not desserts, but deserts where there's not that you don't have access to healthy food or food at all. I think you could run into the same thing in terms of healthcare, and I think that is where the Republicans are struggling.
Let's talk a little bit more about how Medicaid came to cover so many people. I'll throw out a couple of ideas, and there may be more. One is just that it was an approach that was used to under the Affordable Care Act in order to expand coverage. So, as you said before, it was part of the sort of aid to family dependent children, essentially for single mothers before. So it was expanded as a way to get more people into coverage. At the same time, there were some other things that had been discussed, like a public option or co-ops, and those had ultimately not been, either not allowed at all or not been successful. And then during the public health emergency related to COVID, then people could be added to the rules, but they couldn't automatically be taken off. So I think that's a reason. And then, of course, also healthcare has become so expensive that employers can't necessarily afford to cover it, and people can't pay for it on their own. So all those things add up for taking a program that was little to one that's big. And if you cut it, as you say, the need is still going to be there.
Well, and let's go back to, I mean, the one item you raised, which is work requirements. Most states already have requirements that able-bodied people who are working are either they may get access to these Medicaid programs through the Affordable Care Act subsidies. I mean, the whole way in which we finance, support, and extend healthcare is pretty darn complicated, but Medicaid's touching a lot of that. And historically, work requirements are really a cover for, frankly, another level of bureaucracy to disqualify people who would otherwise be on Medicaid. And it hasn't been terribly effective at actually getting the care to the people who need it. But look, this is the reason why they're looking at Medicaid is, to your point, they didn't think there was much of a constituency to protect it. Now what they're finding is doctors, nurses, as well as a lot of folks who are getting Medicaid in these red districts, rural districts, poor areas, really depend on it, and they like it.
So, in another era, we would be talking about hospitals talking about Medicaid, and they don't like Medicaid. They have too much Medicaid, and it pays too little, and they lose money on it. How do we square that with the concern that if it goes away, they're going to go bankrupt?
Well, let's start with the notion that, of course, they make money on Medicaid. I mean, if unless all of the hospitals are completely filled, they're definitely making money on this program. Their cash flow. I don't think I've ever seen a hospital, unless it was trading a higher compensated commercial member or Medicare member, that it would in some ways lose money on Medicaid. They aren't making as much money as they'd like, but hospitals always want to make more money. Having said that, if you actually were to pull those lives out in a material way, hospitals are typically running at, nonprofit hospitals at a sub 5% margin, mostly between 1% and 3%. And I don't know that a lot of hospitals wouldn't. I mean, I'm certain that a lot of hospitals would actually have to reduce their footprint or, frankly, close in certain parts of the country.
So there's new leadership, not just at the presidential level, but also at the level of Health and Human Services, and then Centers for Medicare and Medicaid Services under that. And what do we take, if anything, from what the head of HHS and the head of CMS are doing with Medicaid, or what their attitude toward it might be?
Well, we don't really know yet. I think that I've been pretty public at being a skeptic of RFK Jr., who's a skeptic on science. So I think that he's chasing the demons of autism and vaccines, and he's getting caught pretty darn quickly with measles, and he's appears to have approved a fair amount of damage being done to the NIH and the FDA. But just skipping over all of
Yeah.
that,
Putting
I
that
think
aside for a moment.
he's
Yeah.
he's what we've heard from Mehmet Oz, who just was recently signed in, is that he actually is a fan of Medicaid. He wants to root out waste, fraud, and abuse. The three-headed monster that appears to always be in government programs but never to be found by Republicans. But I think there's legitimate concerns about fraud in any healthcare program, frankly, because there's just so much money sloshing around. But it's unclear to me that you can protect Medicaid reimbursement for doctors and hospitals and make any material cuts because actually, because of the lower reimbursement, which you've raised in other podcasts, where commercial payers, full employee paid by employee insurance, Medicare, which is paid by the feds for the elderly, and managed care versions of all of that, all pay more on a per episode, per day, per service basis than Medicaid. So in many ways, David, Medicaid is the most efficient part of the healthcare system because it's the lowest price. And so I think the Republicans are kind of stuck here, and it's going to be really interesting how they navigate out of the escape room they've designed for themselves without a key.
There'd been some discussion way back when about something called Medicare for All as an approach to universal coverage. And I always thought actually that Medicaid for All made more sense if you're going to go in that direction, largely for the reasons that you've described in terms of just the lower cost. It's also more comprehensive. So if you talk about prevention, social determinants of health, and the continuum of care, it's actually Medicaid. I mean, a lot of what Medicaid pays for is actually nursing homes for people that have Medicare, those dual eligibles that you're describing. So that would be an interesting contrast. Instead of cutting it, actually, maybe everything else should be folded into it.
Well, that is a fascinating topic that we should probably explore on a different podcast because it was a very different direction than this kind of, again, Medicaid. Well, it's really a budget trap that led them to, I think, the cuts to Medicaid trap that are going to end up, rather than solving a problem of the reverse Robin Hood move of giving people tax breaks who probably don't need them, although they may feel like they need them, as the president's crashing the stock market. I don't see this as being anything other than a lose-lose proposition for Republican leadership as they go into the next round of congressional elections. You either got to not deliver on the tax cuts for the people who don't need it that you promised, or deliver on that at the expense of the people who voted you into office. It's going to be really interesting to watch. And I promise, David, we can bring up your perpetual proposal of Medicaid for all on a different version of CareTalk.
Well, that's it for another episode of CareTalk. We've been speaking about Medicaid cuts or maybe radical expansion of Medicaid. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of the Yukon Health System. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.